You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey, real quick, guys, before we start the episode, I want to share something that I'm really excited about. I know how hard it can be when your hormones feel out of balance, low energy, mood swings, and not feeling like yourself, which is why I created the supplement line Optimal Harmony. With natural science-backed ingredients, it's designed to support your hormones, stabilize your mood, and help you reclaim your energy and confidence, because when your hormones are balanced, everything feels easier. You deserve to feel amazing every day, so let Optimal Harmony line of supplements help you get there. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week, I'm really pleased to have joining me Dr. Roland, who is a doctor of dental surgery, and she is here with us today. We are going to have a talk about the mouth-body connection and how important it is to make sure that your mouth is functioning optimally so your body can be functioning optimally. And I feel like this is a topic that doesn't get talked about a lot. So I'm really pleased to have you here today. Thank you so much for being on the show.
Thank you so much for having me. I'm really pleased to be here.
You're welcome. So can you tell our listeners kind of your story and talk about your practice and why are you passionate about what you do?
Sure. Well, I have had my practice for about 15 years now. And I've practiced dentistry, since I've finished school. And over the years, I became very passionate about making changes in people's lives and transforming their life, essentially, as far as how they feel, their well-being, how that we can also transform their look. So I was always out of the box. I always thought out of the box. And I did a lot of research and had the opportunities to meet great researchers and mentors over the years who were able to train me to do what I do today and develop my skills today. So I have a special passion about treating the whole body and having the whole body functional dentistry that I can do for people to help them feel better and look better.
Yeah, which is awesome. It's always good to, when you want to look good, it always makes you feel better, right? Like when you're happy about your teeth and happy about your smile, like I'm sure you see that a lot, right? Like people come in and they're like embarrassed and they don't want to smile, and then once their teeth look great, they're like, wow, I feel so much better.
Yes, they really blossom as a person.
Yeah.
It really increases their confidence. They just generally feel much healthier.
Yeah.
So it's an all-around wonderful transformation.
Yeah. Well, let's jump right in. Like, talk to me about why is it so important to have everything working properly in the mouth? And how does that impact the rest of our physical body?
Well, the mouth really matters. It's overlooked so often. The mouth-body connection is actually incredible, not just from an inflammatory or microbial standpoint, but also from a form and function viewpoint. The way the mouth is actually formed and functions, it affects how the rest of the body functions. For example, having the ability to take in very, very important nutrients such as oxygen, the rest and digest, which is so important for your body, and also most important, getting good quality sleep.
Yeah. Yeah. So when you're talking about like how the body, so if your mouth is not configured properly, you're not going to be breathing properly, right? And not getting enough oxygen.
Right.
And so is that like something that someone's born with, or is it something that like they develop by certain activities? Or tell me a little bit more about that.
Okay. So naturally, beautiful straight smiles are accompanied with features such as a square-like jawline, a strong jawline, a jaw that actually is able to accommodate all of those teeth that were given. It's also accompanied by more pronounced cheekbones, clear airways, and most important, an upright skeletal structure.
Interesting.
And once all these features are in balance, it also creates a more balanced and relaxed look as well, which is more pleasing to the human eye as well.
So meaning if someone is not born with some of those features, let's say their teeth are a little bit crooked, they're not going to breathe as well, is kind of the gist of it.
Correct.
But if you then go and correct that, is that going to enhance their ability to breathe?
Yeah, so I'll give you a little bit of a history. So teeth are actually a very good indicator as far as telling you about your health.
Yeah.
They can showcase how the base of your skull is formed, or how your brain is working, how you're breathing correctly or not breathing
And we're
correctly.
talking about structure of teeth right now, right?
Correct.
Okay.
We're talking about structures beyond the teeth. That
Got
the
it.
teeth are actually
So like
letting
the
us know,
bones.
telling us a story
About what's
what could be compromised within our bodies.
Makes sense.
So, for example, today you're presented with a lot of misaligned teeth,
Yeah.
misshapen teeth, crooked teeth,
Yeah.
impacted wisdom teeth. And this tells you a story that if these conditions exist, then that jaw, the home for those teeth, are actually too small. They don't have enough space. So if the jaw is too small, then naturally now the palate is going to be very constricted. It's going to be too small. So now that's going to compromise your upper airway. And the upper airway is essentially your nose, which is what we use to
Breathe in. Yeah.
And the nose is so important as far as breathing, using the nose. And that's because when you use the nose, the air gets filtered, the air gets warmed up, it's clean, and at the same time, it stimulates your sinuses to create nitric oxide. So now we have that mix. It goes into the lungs, and you have pure oxygen that your cells need for energy and to thrive. But when you're not able to use your nose and you're using your mouth, there is no nitric oxide. There is no cleansed
It's not clean.
air.
So you're getting in much more pollutants. So
you're just getting a bunch of pollutants, a bunch of things that your cells really don't need to thrive.
Yeah. So the structure makes a big difference. And I know a lot of people that struggle with sleep apnea, mostly their mouth breathing, correct?
Yes.
Like while they're sleeping because of this obstruction.
Yes.
I mean, it can be from other things too, but you see that a lot in patients with misaligned. Got it.
I do. So, a lot of kids, for example, as they're growing and you see these signs of the teeth, the misshapen or misaligned teeth that are impinging on their airway, as they're growing. So now what happens is their bodies need air. So now, or even adults, you see that. Now the lips are not naturally closed. That's an indication. And they're using their mouth to breathe. So as they're continuing to grow, then they're growing long ways instead of outwards. And in
terms of the jaw, we're talking about?
The jaw and the space in the middle of your face where you need for proper airway and proper intake of breathing. Because essentially the shape of the face develops those muscles that we need for chewing, for breathing, for having a good posture.
Yeah.
So all of those are very essential. And if they're not developed properly, then you're going to be lacking all of this.
So interesting. So when you're working with someone and you're assessing them, what does your assessment process look like? And what are people tell me about what are people coming to you for?
So people come to me for many different reasons. Mainly because they're interested in just being healthy. But if they're coming in for these specific reasons of say addressing their teeth and why they're misshapen, and they want to do something beyond just making them straight and look better, they're having a clear understanding of how all the structures work together. So we're basically making a whole body assessment, looking at how the posture is in relation to the surrounding structures of those teeth. How are they breathing? Because, the power of your breath is very important for the functions of your organs and development and
everything. If you're not breathing right, you're not getting oxygen. Without oxygen, the body doesn't function.
I always say oxygen is the most important nutrient for your body.
Yeah.
Of course, food is very essential.
But if you don't breathe, you're not living.
Correct.
Interesting. So tell me, how do you assess, let's say that you think they're mouth breathing, how do you actually diagnose that?
Well, there's some clinical evaluations involved with this. There's certain types of pictures that we take, and specifically three-dimensional scanning of the entire structure of the head, the upper spine, and, you know, seeing how the jaw is connected to the base of the skull.
Yeah.
So
you
we're
can
evaluating
tell all of that just from the structure.
Yes, I can tell by doing the full evaluation, especially with the scan that shows me the complete anatomy of how everything is connected. It shows me how what is restricted or what is not. So we can do a complete evaluation to help that person with their specific needs.
Got it. And then what does it look like when you're like, what does the treatment protocol look like?
Again, the treatment protocol completely depends on what's going on and what the patient's goals are.
Gotcha.
We're really, individualized as far as what your specific goals are. Is it that the patient wants to rejuvenate their smile? And, you know, if their teeth are, say, worn down, say from grinding,
Got it.
Or they're just really worn down from a lot of discoloration, so many different reasons.
Yeah.
And that worn dentition has now created a collapsed bite, which in turn has now created imbalance in the facial features that go along with it. And then that will affect function and how the rest of the body stands. So we can completely do a transformation and create the balance in the entire body, and then have those teeth revitalized or rejuvenated.
Yeah. And it's not just cosmetic.
Correct.
That's what I feel like I'm hearing is like, yes, you may want to get your smile fixed so that you look beautiful or whatever you want to look, but it's also affecting your function.
Right. And you want it to function appropriately. You want those muscles that are helping you with chewing or breathing or smiling. You want them to be comfortable. You want them to look good and feel good. So we do we look at the whole picture and treat the whole picture. So that way you will experience that long-term comfort and beauty and everything all the way around.
Yeah, it's really cool.
And I would say it's the same concept. Of course, children are it's more about how their teeth are coming in, why there's not enough room. Space, and again, it's looking at how their body's going to function and how you want to set them up to have a good future, to avoid having their jaws hurting in the future because they're cramped up, or avoid having any kind of sleep disorders, or avoid having them be fatigued and cranky.
Yeah, it leads into behavioral stuff, right? If you're not sleeping well, you're not getting oxygen during sleep. We see this in adults. I mean, and we mostly treat adults here, but you know, if people have sleep apnea, it affects everything, right?
Yes.
It affects their mood, it affects their hormones, it affects their digestion. Because essentially, I mean, you mentioned rest and digest earlier on. You know, if you're not getting enough oxygen, that's going to put the system into fight flight. It puts you into stress state. Right. So if you can get the functionality better, the system's going to calm down, which is going to affect everything. Not just structure. It'll affect like hormonal function as well.
Exactly.
Talk to me about how cavities and tooth decay comes into play here. Like, do you see an increase in cavity production when someone's a mouth breather?
Yes,
because you're getting like more bacteria, or tell me about that.
Well, when you're mouth breathing, that immediately changes the chemistry of your mouth.
Yeah.
That eliminates the neutral pH that you should have. It dries out the environment for those good microbes to thrive. So those disease-causing bacteria will start to outgrow the good ones. Yeah. And they start creating the decay. It's kind of like, you know, leaving sugar
in your mouth.
In your mouth.
Yeah.
And they're basically having a party.
Yeah.
So it's the same thing. Now you're giving it a good environment for them to thrive and grow.
Well, and you know, we have to remember that your mouth is a part of your whole digestive tract. So if you're mouth breathing and we're having more bacteria hanging out there, it's going to affect not only just your mouth, it'll affect everything in the digestive tract. I mean, we treat a lot of GI disorders, and a lot of people with SIBO and IBS and all these things, like they tend to have more mouth issues or more cavities or more, you know, and usually, you know, we talk to patients about, hey, you got to make sure your dental hygiene is in a good place. And the mouth breathing thing is a big piece too, because that might not be something you can like brush your teeth more and fix.
Yes.
Right?
Yes. And I was going to say also inflammation of your gums.
Oh, yeah.
Because your gums are essentially protecting your teeth and the roots of your teeth.
Yeah.
So you can get a tremendous amount of inflammation from those disease-causing bacteria that are going to thrive.
Yeah. Yeah. Yeah, and you know, it's like if you've got heart conditions, other conditions, if you've got bacteria living in your gums, that's going right into your bloodstream.
Exactly. And
so it can have an impact all over. I have a couple of patients that with a lot of gum inflammation, and every time they go and get a dental cleaning, they get urinary tract infections because I think there's so much bacteria and inflammation.
Wow.
And, you know, and I've actually found some really interesting research. I don't know if you're familiar, but that connects that, like where it just goes straight to the urinary tract. And like, at first I was like, this sounds really weird, but I looked it up and I'm like, oh, this is pretty interesting.
Yes.
So, you know, we have to do like a really good, we're supporting their urinary tract a lot before they go and get a cleaning. And also I'm thinking they might need to come to you because I feel like they need to have some structural stuff looked at to figure out like, hey, why are your gums so inflamed? Like, why are we getting this, you know, systemic effect elsewhere?
Yes, yes. And also another way to control it is oxygen ozone.
Oh, do you use that in your practice?
I do use that. It's standard
fantastic.
in my practice.
Yeah.
And I use it for cleansing of every single procedure that we do as far as, you know, dentistry
So you do
goes.
that like before you do a cleaning or?
I do it during.
Wow.
Or I use it as a therapy for improving the gums.
Yeah.
A lot of
because that's going to kill everything, right? All the bad bacteria?
Well, that is really good with balancing out the chemistry. It targets those disease-causing bacteria. So it lowers their numbers and allows those good bacteria to thrive. Because essentially those anaerobes or disease-causing bacteria don't like oxygen. So when you expose them to this therapeutic level of oxygen, then they're very unhappy. And they just, you know, go
They don't
away.
live. Yeah, they're going to die.
Yeah. And actually, when you're and people present with, you know, pockets of infection or pocketing, and it's amazing.
So is that like a pocket in the gum? Is that what we're talking about?
So the gum that is attached to the tooth with little fibers, when you have those bacteria in those pockets, they're going to start eating it away, and it gets deeper and deeper. So it goes.
And
it's not now protecting the root. So you can get bacteria going really deep in there, and then they're diagnosed with, you know, gingivitis or periodontal disease. But if you actually utilize this oxygen ozone therapy, it's really amazing with the complete rejuvenation of these gums.
That's fantastic.
And how healthy they look and feel almost immediately.
That's amazing.
So, you know, inflamed gums are really red.
Oh, yeah.
You know, they bleed a lot, and then you expose them to this, and they almost immediately, you see the pink color, awesome. The swelling and the inflammation just going down, and give it time to settle. And it really works beautifully.
That's very cool. So you're doing that with almost every single treatment when someone comes into you.
I do it for all my treatments, not just, you know, cleanings or, you know, gum disease, but also when you're...
Like filling a cavity or...
Yeah, doing any kind of restoration, whether it's a filling or a crown or whatever is needed to restore the tooth. Yeah. I make sure that I cleanse all the surrounding areas once I isolate. Yeah. I cleanse it really well with the ozone. And that creates this environment that whatever you bond to, or if there are some bacteria left over,
bacteria in there,
everything is super clean. That you're bonding and putting a restoration on something that's so clean.
Should probably be standard in all dentistry. Because I feel like I hear patients that, you know, they get a root canal or a crown, and then there's some sort of infection. I mean, I have patients that they'll swear they're like, all my health problems started after I got these 3 root canals, and then they'll end up going to see somebody who does biological dentistry. They're like, oh, we found there was infection in there, and that was affecting the whole system. Yeah. So do you do root canals?
So I personally don't do the root canals. Yeah, however, I do work with a great endodontist who will do the root canals. But what I like to do is, again, I like to utilize the ozone for the root canals, because that actually will target those little nerve endings that you may not mechanically be able to get to. So it actually cleanses inside of the root really well as well.
Yeah.
Yeah.
And how about, what are your feelings on, oh my gosh, what's the word? Implants, dental implants.
Implants?
Do you feel like those are preferable over if someone needs a root canal? Would you say get a root canal, or would you go for an implant? Or
I
does
mean,
it
it
not
really
matter?
depends on the situation.
Yeah.
I always say there's nothing like having your own teeth.
Your own teeth, yeah.
And things in the very near future will be coming up. I mean, in terms of maybe some dentistry that can create your own teeth.
Oh, really?
There's a lot of research that is going on that hopefully that will come in the near future. But I don't have enough knowledge to really talk about it at this time, but perhaps in the very near future.
Well, that's kind of cool. Yeah. That's exciting. So I feel like this is really important work and really important for people to hear about this, because I think sometimes, I know I've been like this in the past, like we don't realize, hey, like when you go to a dental cleaning, like there's a lot of stuff that could be going on in there, and if you're not really looking at how it's impacting your whole body, you might be missing a piece to your health.
Yes.
Right?
Yes, for sure.
Yeah. So tell me a little bit more about your practice. Do you treat all ages? Do you treat just adults, kids? Tell me about that.
I treat all ages.
Cool.
I have patients from 3-4 years old to patients, in the older population.
Yeah. I mean, I think it's really cool to start doing this type, like looking at a child and how they're developing, and if you can get that kind of straightened out early on, isn't that going to impact their later years a lot? But
yes, and that is really the goal, is to set up a very good foundation for them so that they can grow up the way nature intended for them to.
Yeah.
And they can just be healthy as they grow and stay that way.
Yeah.
Because a lot of times today, the way they're supposed to grow is altered.
Yeah.
So we want to get them back. The body knows what to do. The body's very interconnected. Yeah. So I just give it the tools and allow it to find its way back to what nature intended.
Yeah.
And those kids will grow up very healthy as far as structurally, and having the ability to use their power of breath and use their power of swallowing, or have good postures and continue on life being healthy.
What's so interesting, I was having a conversation with, I was telling you before, I have 2 kids and 3-step kids, and we were talking about how a couple of the kids in our house have perfect teeth, never had a cavity, teeth are super straight, and my older daughter, literally, I don't think she's ever had a cavity. Her teeth, she always gets a clean bill. My younger daughter has had more cavities than I can count. She just had to have a ton. And I feel like I'm thinking, I wonder if she's not breathing well. I wonder if she's mouth breathing. Would that, because they eat a pretty similar diet, right? Same genetics. Like, it's interesting how, do you see that a lot in families where like one kid will have like no issues and another kid will have a ton of mouth issues?
Yes. And just going back, I just want to say one thing about, anthropologists have been studying the human jaws. Yeah. Okay. And they have found a link between the shape of the jaws and the demand for eating. And how over time, this shape has changed. It has become smaller and weaker.
Oh, yeah, because we used to have so much bigger face. Oh, that's interesting.
And with that being said, there's been a lot of research that the modern diet, unfortunately, has created the situation. And a lot of processed foods, ultra-processed foods, not only do they deprive you of all the good nutrients that you can have to grow, it's mushy. It doesn't give. You don't
have to like chew as hard.
Yes, it doesn't give you the exercise, because those muscles need exercise to help you grow. Yeah. And over time, this has been happening in humans, and that is why you are seeing
like the faces get smaller and smaller, and the jaws get smaller.
Yes.
Wow.
Very interesting.
That is really interesting. So it's not just about the nutrients, it's also about the fact that we don't have to like...
Yeah, the food actually not only is there to give your cells
but it's
energy,
supposed to work out the muscles.
It also, it really forms your face. Yeah. The food forms your face.
Well, I mean, isn't the masseter isn't the strongest muscle in the body?
Yeah. Well...
One of them?
Yes.
I mean, for its size, right? I remember, I feel like that was a board question way back in the day. Like, what was the strength of that muscle? But what, Do you ever have people do like facial muscle exercises to help strengthen their jaw muscles?
That is one of the treatment. I always say, you want to make sure the plumbing is there so you can use it.
Yeah.
Right?
Yeah.
So I have to create that foundation for you, and then you strengthen the muscles.
Yeah.
And you teach your body how to breathe, how to use your organs properly, how to use your muscles properly. So you do exercise them because muscles have memory and they're going to learn.
Yeah.
So all of that is done once the foundation is created and the gates are open, and now you can use it.
Yeah. And then it sounds like posture will get better. Like
absolutely.
So many things are going to shift for you.
Yes. I mean, how many people have you seen with that, especially even kids, with slouchy postures?
Oh, yeah. I mean, I'm guilty of it myself. I'm just sitting here being like, I need to keep my
shoulders
shoulders
back. I work on that too,
right?
being a dentist. So,
Trying to pull your... I've been having some trap issues, and my PT is like, because you're hunched over all the time. I'm like, I know, I got to keep my chin in. And yeah, it's hard. I mean, in our society too, especially as a mom, when you're like, we just did an episode on like postpartum, you spend so much time like you're holding your baby and you're hunched over, right? You're nursing, you're carrying your little ones. But now we're on cell phones all the time, right? And we're hunched over and we're looking at the phones. And that's not, I mean, that obstructs our breathing, right?
It sure does.
We breathe better when we're back here and everything's open.
Correct. And you can actually feel it.
Yeah.
And feel the difference.
Yeah.
And those who have those structural imbalances that don't have the ability to do that, it's very hard for them. So they naturally go back to the compensated position so that they can survive.
Yeah.
But they don't have to live like that. They can make changes.
Yeah.
Yes.
Wait, and I think you also like so many desks that we sit at, you're hunched forward, you're looking at your computer, if you're not in a good chair, like there's a lot of things we do in today's world that aren't really conducive for the good posture.
Yes.
But that's really interesting that some people didn't form that way, and so it's easier for them to do that.
Yes.
So this is where I think it's really good to have your child, to have your kids get evaluated for this.
Yes, for sure. And, I'm a mom of 4.
Yeah.
So all of this is very important to me personally as well.
Yeah, to help your kids.
So I not only help them, I might drive them crazy just because.
They're like, Mom, shut up about the posture and the teeth. Yeah.
Right. But I really, when I make a difference in other people's lives, it's really, really a pleasure.
Oh, yeah. Yeah. Well, this has been a fantastic conversation. I feel like I've learned so much. I'm so glad that we had this conversation. And
thank you.
Can you, if people are local and they're interested in working with you, can you tell them a little bit about where to find you, what it looks like, what that looks like?
Oh, sure. Well, I have my practice in Annapolis on Defense Highway.
Awesome.
And it's right across from the mall.
Yep.
So it's very easy to get to.
And what's it called?
It's called the Center for Transformative Dentistry.
Nice.
And I'm Dr. Roland.
Yes. And we'll put the links to your website in the show notes so you can find it there. If someone is not local and they're interested in finding a provider who does similar work, do you have a resource for them? Where can they go?
I can go online and try to find, but it's very hard to find other people, especially in the area.
Yeah. But what would they look up? Are they looking up like a biological dentist, or what would be the?
Well, not everyone is created the same.
Yes.
So you just have to research, the
practice and see
the practice and figure out on your own if this fits your personal needs.
Got it.
But I've been blessed that I have patients not just locally, but
travel
do travel.
That's fantastic.
Even from other neighboring states, they come in and for treatment.
Because there's probably not a lot
because
of
there's
dentists
something
like you.
specific that they're looking for, and they really understand the concept, and we make it work and we make it happen.
Very cool.
Yeah.
Well, thank you again so much for being on the show. I hope you guys enjoyed
so
it, and we'll see you soon.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.